I want to turn now to the National Disability Insurance Scheme. The Minister responsible, Stuart today announced a new chief executive, a new boss of the NDIA, the agency that runs the NDIS. And Stuart, the Minister, joins me now. Thanks for your time.
Pleasure.
Martin Hoffman has been named as the new CEO. They've been without one for a while. Why has this taken so long?
When you do a national search for a CEO, it takes a while. An election got in the way in the middle, of course, and that tends to disrupt things. But Martin Hoffman is an extraordinary Australian. The former Secretary of the Department of Finance, Social Innovation in New South Wales, former DepSec here, former corporate CEO, a man with great experience, and a man who's lived some trauma and tragedy in his own life, so understands full well.
Well, I was going to ask you, where does disability fit into his CV?
Well, the head of Department of Finance, Services and Innovation, that includes Services New South Wales that he's overseen for the last 3 years, so the entire service delivery architecture of that state. It's someone comes with very, very impressive service delivery credentials.
But anything specific to do with disabilities?
Well, in terms of the way that New South Wales provides services to its citizens, it's across the full gamut of service delivery. The full gamut.
Okay.
For every single one of New South Wales citizens, including the work that Service New South Wales brought everyone together.
Will he be based at the NDIA headquarters in Geelong?
Well, we'll leave that to the board to decide, but I'm very relaxed in terms of what decision the board makes.
You'd expect the CEO to be with where the agency headquarters are, wouldn't you?
Well, keep in mind the Safety and Quality Commission is based out of western suburbs of Sydney. There's a number of executives based around the countryside. This is a national scheme.
The whole point of decentralisation is to have the organisations outside Canberra and led outside Canberra, isn't it?
Well, the whole point is to find senior executives that will make a significant difference to the organisation. And where they live is largely irrelevant. Now, he'll have an office clearly in Geelong and he'll spend a lot of time there, but I want him to spend an inordinate amount of time outside of the headquarters. Work doesn't get done sitting behind a desk. It gets done out there at the coalface, working with participants in the scheme.
You've also announced an increase in the staffing for the NDIS. Has the actual staffing cap been increased?
Well, shortly when I came in, I asked the agency what it needs to deliver the aggressive forward agenda that I'd set, including Disability Reform Council meetings every quarter, solving issues like justice and mental health and out-of-home care and hospital. And the answer was they needed another 800 public servants to provide sign-off on plans and scheme areas. So that's been provided to them, that decision I made many, many months ago. 300 of those 800 have already been employed. And that was the number they set. Now, that brings the total number of staff working in the NDIS to 12,000, when the PC Commission recommended 10,000.
Yes, so there's 12,000 now, is that what you're saying? Well, there will be 12,000.
There's 12,000 now across permanent public servants, across a contracted workforce.
There's a lot of contractors, aren't they? The contractors and consultants and so on.
Well, there's lots of people. We use local area coordinators. People have worked in their regions, their communities for upwards of decades and decades. Do you seriously, David, want me to say to people who've been working in disability in outer Megathara for 30 years, I'm sorry, I'm going to replace you with a public servant? Or would Australians expect us to use the local expertise the way we're using it now?
And is that the ideal model? You're confident that that is delivering the best result?
It was what was recommended by the Productivity Commission, to use local area coordinators. And if we think it through, using local people from local communities who've been servicing people with disability for decades and decades, using their expertise within our model, I think it makes a lot of sense.
You've now got the chief executive in place. You think you've got the staff issues sorted. What's next on the fix-it list for you, Minister?
Well, it's substantial. We'll announce the full government's plan in the coming weeks. We've just finished COAG, the Disability Reform Council, where we solve mental health, justice and transport interfaces. There's still a strong work program going forward. I need to deal with the reserve fund. We need to look at how we're going to manage research and development. School transport has been pushed off for a few years, but there's still 300,000+ in the scheme. We want to get towards 500,000, and I'd like to solve the last 20% of the policy challenges we have, which then takes us to business as usual for the scheme.
Do you think we'll have another underspend?
It's $17.8 billion is the total allocated for this financial year. And remember, the last financial year, the reason why we didn't hit the forecast numbers, it's demand-driven, uncapped scheme. So whoever comes in is provided services, but 100,000 people that were the states and territories said would come through, numbers from the old block funded, just don't exist. We can't find them. Now, the good news, 169% of new participants. So we expected 69,000. We've got 117,000, which is wonderful. There's 100,000 people now in the scheme who've never had a state-funded provision of service in their life. 100,000. And I think that's superb.
There are still issues there, and certainly anecdotally, some of the concerns I hear is that people have to go back every year to reapply for a new plan, and that's very time-consuming, and that's, you know, sometimes does not deliver what they need under that plan.
I agree completely. We're going to move people to 3-year plans if we can.
Right.
The other thing I want to do
When's that likely to happen?
It's happening now as we speak. 2- and 3-year plans are being rolled out at plan review. The other challenge I've got is my legal advice is that if you want to have a small part of your plan re-looked at, you have to get the entire plan re-looked at. Now, that clearly doesn't make sense. It's not flexible. I want to change this so people can say, hey, I like 95% of my plan. Can I have a look at that? And I want flexibility and a common sense approach to just fixing that. And that will take, I think, a lot of fear out that people have about, hey, I only want to fix this. I don't want the whole thing being reviewed.
Just finally, away from the NDIS, you've just sat through lower house question time and a lot of demands from Labor for a debate on the economy. Why isn't the government willing to give that debate?
Because after question time, of course, we have a matter of public importance, what we call an MPI. If the Labor Party were really serious about having a debate on the economy, that matter of public importance would be about the economy. And yet, right now, in the House, that matter of public importance is not even mentioning the economy. This is a stunt, David. If they were serious, that MPI would be about the economy today, and it's not.
Stuart, Robert, thanks for joining me this afternoon. Appreciate that.
Great to talk.